We've done very well in trying to figure out what we think is causing language decline after temporal lobe epilepsy surgery. And that is two specific connections within the brain that connect different brain regions.
Fellow Homo sapiens, my name is Torie Robinson and welcome back to Epilepsy Sparks Insights. Epilepsy surgery is outrageously underutilised as a tool for decreasing seizure frequency and severity, or even stopping seizures entirely, improving people's quality of life and reducing their risk of injury and early death. It can be incredible, and I stand by that myself as somebody who has had most of their temporal sclerosis tissue removed. However, the surgery that we're talking about today, a temporal lobe resection, commonly can also negatively impact people's memory. However, and gosh, talking about the epilepsies, it's full of howevers, but also worth considering, just for perspective, is that if as a result of the surgery a person has fewer seizures and may be able to decrease their anti-seizure medications, then their cognitive function would be likely to improve, amongst many other things. Today, we hear from a physicist all about his research into temporal lobe resections and how we can potentially not just minimise the impact on a person's cognition, but also potentially even improve it. May I introduce to you Sjoerd Vos from WA, Australia.
I'm Dutch originally, working in medical imaging field and MRI scanning specifically. After doing all my uni stuff in the Netherlands, I moved to London, where I came to work in epilepsy. And then after 8 years in London, I moved to Perth in Australia. Not necessarily for the weather, but it's a very, very good benefit to living here.
Lovely when it's cool enough, but in summer can be challenging, right, in Perth?
Definitely can, yeah. Summers are hot, so the 40-degree days are a bit challenging. Luckily, everything is inside and air-conditioned, and that helps a lot.
Tell us what you do in neuroimaging, because I think lots of us, even some clinicians, no doubt, will think neuroimaging, oh, okay, cool. So maybe he goes and presses the buttons to do a couple of MRIs for patients or something. But there's way more to it. What do you do?
With MRI scanning, there is quite a lot of buttons to push and quite a lot of things to set up. So that's what I work on, MRI scanning. So that can provide almost infinitely different contrast and pictures of brain anatomy specifically, or anywhere in the body. And my role as a researcher and as a physicist by training is really to set that up to get the best images that you can in probably as short a scan time as you can, both for the institutions financially and for the patient experience. And that is a lot of work, to be honest. I think there's hundreds, thousands maybe of researchers trying to work on improving what scans we get from the brain in a shorter scan time all over the world. And over the time in London, I started working in epilepsy imaging, and that's kind of continued throughout in the last 10, probably 12 years since I started working in London. A lot of it is naturally sort of tying in with the clinical side, obviously what they currently do clinically to try and improve what that is.
And so just tell us a little bit about some of your research, if you can.
Yeah, so I've had the joy in London to work across a very broad range of epilepsy-related topics. Most recently on a project funded by Epilepsy Research UK, or Epilepsy Research Institute now, where we had funding between myself, John Duncan, and a few other people across the UK to hire a PhD student and do some research into trying to improve the outcomes of epilepsy surgery. So when epilepsy doesn't get controlled with medication, and if there's a one specific lesion or area within the brain what we know is causing that epilepsy, surgery can be an option to treat by surgically removing that part of the brain that's causing the seizures. Obviously, if you go into a surgery, there's bits and pieces of the brain that you need to take out, but there's a lot of functions in the brain that you obviously don't want to disturb. And the project we had funding for was to try and reduce the amount of language damage or language decline that people with undergoing the surgery would accrue because of the surgery. Language is already affected by in people with temporal lobe epilepsy. So if we could try and reduce how much damage we do with surgery, or even improve it.
So this was all temporal lobe epilepsy you were focusing on, was it?
This was all temporal lobe epilepsy, correct, yeah. So that was the aim of the project, and luckily with a great PhD student and a great team across all various sorts of specialities, from neurologists to surgeons to neuropsychologists involved in the language testing and understanding, and imaging specialists within the group. We've done very well in trying to figure out what on older data, so established data, what we think is causing language decline after temporal lobe epilepsy surgery. And that is two specific connections within the brain that connect different brain regions across sort of the longer distances within the brain or within the head. And those sometimes get damaged within surgery.
And which regions are they?
So those are the inferior frontal occipital fiber, which connects the frontal and the occipital poles within the brain, so front to back primarily. And that is the middle longitudinal fasciculus, which runs from the temporal lobe, which obviously is affected within TLE, to the occipital lobe as well. And they're at risk of damage from surgery. They don't get damaged in everyone that undergoes the surgery, because everyone's brain anatomy is slightly different. And the surgery for everyone is just slightly different based on, natural factors. So based on, I think, a cohort of 100 plus cases from London, we managed to find out that there is a correlation between damage to these two structures and language outcome, and a prospective study to validate whether that actually can help people improve the surgery, or can help us improve the surgery for patients with epilepsy. That's still ongoing. I think the delays post-COVID are still affecting that, even these many years after the lockdowns and the pandemic. But that's ongoing still.
What benefits does what you have learned through this research, what has that brought, or what shall that bring in terms of improving surgical outcomes, do you think? And has it already benefited patients, or are we waiting kind of until the end of the study?
Having looked at some of the preliminary data just as we go, to make sure that we're doing what we planned on doing, reviewing it with the whole clinical team, I think that is looking promising, in that so far the ratio of people having a language decline is lower in the prospective study of trying to validate this than it was before. Obviously, that could just be by luck, because we haven't really gotten to the end stage of the study yet, where it might average out over the 2, 3, 4 years that this study runs. But hopefully that means that if it is the case, then the people part of the study will have that benefit already. Once that gets confirmed, hopefully, we can disseminate that and make sure that everyone else in the world and all the other epilepsy centres can do that too.
And I can say, as someone who had temporal lobe resection about 12 years ago, I do see even improvements today compared to way back. What would you say to people who say, oh, do you know what? I'm going to kind of hang on for now. I'll see if things improve in the future, because lots of people are nervous about surgery too. What would you say to that?
I can totally understand that. I've had enough operations, all orthopedically, to know it's never nice to have to go through. It's always worrisome for yourself and people close to you. I do think that the evidence in epilepsy is there that if you have the surgery earlier in your course of epilepsy, or as early as is recommended, that does improve your outcomes. So that's in part because obviously every seizure kind of has an impact on the brain, and over time things get worse. Technology and understanding does get better over time, and in 5 years' time we might have better treatments, medications or other treatments. But I think from a surgery perspective, I think the literature is quite clear that the sooner the better. I've had a really rewarding collaborations within London on epilepsy, partly with the clinical team and partly with the patient, and sort of responses that I get at events like the Euro UK grant launches and everything that I've had with a variety of people, that I think it's been a very rewarding field to work in, and I'd love to rekindle that here in Australia. So currently I work in an imaging centre that's generally doing all kinds of research on MRI scanning and medical imaging, with very little epilepsy research happening with MRI scans. There's a lot of clinical-based sort of population studies and medication studies that I wouldn't necessarily be involved in. But I'd love to get back into that more. I think there's so much to do. Yet partly the research community, like having so much interaction at conferences and meetings. It's a very inspiring and fun field to work in. So that'd be my prime aim over the coming months, having been here a few years now.
Well, there's the Australian Epilepsy Project, right, which is coming over to Perth.
That's right. That's a very big study led from the Torie Institute in Melbourne. They are currently rolling it out across the whole country, and we're in discussions with how to set that up here. There's a few practical and technical aspects to tackle, but hopefully we can get that sorted before the end of the year and contribute to their amazing research.
Huge thanks to Sjoerd for the reassurance that researchers and clinicians see the importance of cognitive function to people's quality of life, sharing with us his cool research and giving us something to be excited about for people who have a temporal lobe resection in the future. Do check out Sjoerd's papers and more about his work on the website torierobinson.com, where you can also access the podcast, the video and the transcription of this episode. And if you haven't already, please don't forget to like, comment and subscribe to this channel and share this episode with your friends, family, colleagues, whoever it might be. See you next week.